everybody. This is Victoria, the Council on Aging Director, and I am joined by Miss Aileen Lemoine. She is a pharmacist, and she's joining us with the Mass College of Pharmacy with their outreach program, and she's going to just give us some information today about the COVID vaccine.
Hi,
Thank you so
everybody.
much.
Thank you. Thank you, Victoria. And I'd like to say hi to everybody. My name is Aileen. I am one of the pharmacists at Pharmacy Outreach. Let's see. So we'll go through and I'll give you some information about who we are, and what we do. So who we are is we are a nonprofit organization funded by grants from the Executive Office of Elder Affairs of the state, the City of Boston, Age Strong Commission in the Central Mass Council on Aging, as well as Mass College of Pharmacy University. We operate out of the Worcester campus, and our primary focus is helping people across the state who are having trouble obtaining their medication, affording their medication. They have medication questions, or, why am I taking this? So we are free to everybody in the state of Massachusetts. Okay. So to contact us, we have our toll-free number is 866-633-1617. We are available Monday through Friday, 8:30 to 5. We also have our pharmacy outreach website on the Mass College of Pharmacy page. On our website, there is the Ask the Pharmacist link. So if you have a medication question, it goes into, if you have the access to the internet, you can put your information in there and it shows up to us by email. The other thing we like to do typically without a pandemic is we like to go out to different places across the state and actually visit with people. Obviously, that's a little harder right now. So that is why we are doing everything by Zoom right now. And we're a small office. We have caseworkers, pharmacists. We have a geriatric fellow for pharmacy. And we are one of the rotating sites for pharmacy students who are on their last preparation to being pharmacists. So again, what we do is we will answer any questions people have about medications or diseases. One thing I can do is provide you a one-on-one medication review where I would go through all of your medications and we would look at see, are there any duplicates? Are there any side effects you should be watching out for? Are there any conflicts? So those are things that I do. We have Paula and Bill in the office, also our other pharmacists. We research ways to help save you on the cost of medication. We evaluate insurance plans, especially open enrollment is our highlight. We are all hands on deck at that point because we are rapidly doing reviews to make sure formularies change every year. So we want to make sure that you will get the right coverage for the following year. And we go out to these outreaches to try and help people understand a little bit more about their medication. So today I just wanted to quickly go through some ways to how do you take your medication and afford them, that's something we would help with. Understanding why it's really important to take your medications the way the doctor prescribed. And I'll do a little bit more about the importance of the COVID vaccine. So to go for a start, some programs that can help you with affording your medication. So what we start with when we're talking with somebody who's retired and over 65 or under 65 with a disability is we'll start with Medicare Part D. They're private insurance companies and they are all based on your medication. So what might be right for your friend could be the completely wrong plan for you. It all is by your medication list. So when we do these reviews for open enrollment, We will go through your exact medication list and find the plan that will help you the most to afford your medications and to try and save you some money. Um, so when we work with you, we will go through, we'll put in your plans, we'll figure out what is the best. We'll try and find out. Sometimes there may be a lower cost medication on your plan. Sometimes there could be a formulary issue. We have a lot of times annually where maybe the red Pro Air inhaler has been on your plan. Well, now it's the blue Ventolin, same thing, but you're going to save money. Same thing with those insulins, Novolog, Humalog. It just all depends on what the plan formulary is. So we will look at different ways we could save you money there. And then we'll try and find out if we can help you. The deductible is really hard to try and find help with, but in the coverage gap or when your medications aren't on your formulary, we'll do things to try and help you with that also. Uh, One of the ways for the donut hole, I don't know if you know what that is, but when your medication is processed through your insurance, your plan, the Medicare Part D plan, is keeping count of the cash cost of your medication, not necessarily your copay, but how much, if you were to go in and say, I want to buy this medicine for cash, how much would it cost? So maybe it's $100 or $1,000, but that adds up. And when you hit a certain dollar amount, you go into the donut hole. And that's where, like on a brand medication, you could be paying up to 25% of the cash cost. And that can be very painful financially for a lot of people. So, one thing we will look into is Prescription Advantage, which is a free program through the state. It's a really great program if you qualify, that will pay. When you go into the donut hole, you would be paying no more than $12 for generic for 30 days or $30 for a brand for 30 days. And it really decreases that burden financially of when you are in the donut hole. One thing we want to make sure with people is you're not over medicating, and we want to prevent harmful drug reactions. You need to be careful of your over the counter medications. It is really, really helpful for you to keep an updated drug list in your wallet. A lot of times when somebody goes to the hospital, when I was in a pharmacy dispensing, I would get a call from the ER asking me what their medication list was. And that was fine, and I could take care of it. But that's only when I'm open. Or if you're in a mail order pharmacy, they don't have as easy access. So, to get you the best care as quickly as possible, it really helps that if you have that medication list in your wallet, you could put it on your phone. If you have a smartphone, you could go in and just put it in one of the notes sections, just so that should you ever need to arrive at the emergency room, you have that list available and care can be provided to you as quickly as possible. Never be afraid to ask questions. Um, I've had questions from people, um, and a lot of it is like, can I take cranberry? You know, I've been having urinary infections. I want to take my cranberry tablet. Um, but then maybe if you're on something like warfarin, which is to prevent blood clotting, cranberry is not a good idea. So those are things to be careful and ask questions in your pharmacy, at the pharmacy counter. Following the directions is important on your medications, but also make sure you understand those directions. A few years ago, I had a man come to me and he was getting a new prescription for his blood pressure medication. So I asked him, did the doctor tell you how to take this? And he said, yeah, I'm doubling. I said, yep, that's absolutely true. You know, he was going from the metoprolol 50 to a metoprolol 100. He started coming in complaining of dizziness, and he started really having bad vertigo and everything. Nobody could figure it out, back and forth to the doctor. 2 weeks after he filled that prescription, he showed up for a refill. And I said, I gave you 30 days 2 weeks ago. He said, yes, my doctor said double it. So even though I had thought I was asking him in the best way to, do you know how to take it? I needed to ask more specifically, because instead of going from 50 milligrams to 100, he'd gone from 50 milligrams to 200. And that was exactly the cause of his dizziness. So it's important to follow the directions, but ask for clarity along the way if you don't understand, and report those problems if it's something like dizziness or anything like that. Talk to your pharmacist, talk to your doctor about, maybe what you're experiencing is the side effect. So trying to take your medications as safely as possible. One thing is using one pharmacy, but I know nowadays it's not that easy. If you're getting all of your maintenance medication from a mail order, and now you get some kind of other prescription prescribed to you, and you go to your local pharmacy to fill it, just make sure the doctor prescribing has a full list of your medications, just to make sure that there are no interactions. When you go to your pharmacy counter and you pick up that refill, before you leave the pharmacy, check the label and the contents. Make sure it is what you've been looking for. Make sure it's the right medication. If it, a lot of times generics change color, they change companies. So those are something you can ask. But it's also maybe one of your medications you're no longer filling or taking has been filled. Once you leave the pharmacy, once you leave the store itself, they're not allowed to take it back by law. So just check it while you're there, make sure it's exactly what you're looking for, and have any questions to ask. Never take medications in the dark, which, it seems like we all understand that, but even I've been caught trying to take some ibuprofen for a headache in the middle of the night. And I'll go by feel for the bottle. I've learned to open the microwave and just make sure I'm taking the right medication. I had a patient who kept all of her medication on her nightstand, picked up what she thought was the methotrexate that she took once a week for her arthritis, but instead was her Xanax, and she took way too much of it. So that is something to be careful of, is like, if you're tired or if you can't really read that label, make sure it's what you should be taking. And never share medications, because what might be right for you that the doctor prescribed may not be right for somebody else. Or it could be that it's just it could interact with the medication they're on. So just always don't share your medications. Once a year, it is recommended that you do get a medication checkup, and that can be done with your doctor, with the pharmacist at your local pharmacy. We can do it. One of the 3 pharmacists at our office can do that, just to make sure we go through and just you understand how you're taking everything. Sometimes if you've gone into the hospital and come out, there are questions over what should I be taking, what shouldn't I be taking, especially when medications are changed. And it's really important that wherever you store your medications, clean it out on an annual basis. Don't keep old medications lying around. So going by that, if you have your where you store your medications, it's not good to have them in like the bathroom medicine cabinet, just because of all that humidity from the shower. So you have to be careful of that. You want to make sure to keep your medications out of sight and reach of children. It just seems logical, but storing your pet medication somewhere separate than yours, because sometimes, again, those medications can look the same, but you don't want to be taking your pets by accident. And to be careful of where you're storing your medications. If you're having people come into the house to do work or things like that, you got to make sure that if your medication's in your pocketbook, it's not around, or it's not somewhere where people can just easily pick up something and walk away with it. So those are just a couple important hints. Going into tablet splitting, if the tablet is safe to split, it has that score line in it. So that's a big way to know. Um, but I know it's hard because splitting tablets is a challenging thing. So you want to try and only split the tablets that you intend to use at that one particular moment, particularly in the summer when it's really hot and humid. Um, Most medications that end with SR, CR, XL, um, those should not be split because those are like a controlled time release medication. The only one that definitely can be is the metoprolol XL, and it has the score line, so you know that's safe. Going back to cleaning out that medication cabinet, um, there are different ways to get rid of the medication. Police stations routinely before the pandemic had a drop box in their lobby. Some of them are not open right now because of the pandemic. They don't want a whole flow of people in and out. Um, there's also the drug take back days, which happen about 4 times a year. Those are good times to get rid of it. So if you can't get rid of it at those times, um, what it's suggested is that you take that extra medication and put it with some kind of messy trash. Dump the tablets in or the liquid in with coffee grounds or kitty litter or the tray that the chicken came in. It just starts dissolving those tablets and it makes them unappealing to people who could be looking for them. So just dump the tablets or any other things in that kind of a trash and throw it out. Take the label off of the vial. Don't throw the label in with the in the same trash. You don't want anybody to have access to that information. And a couple medications to be careful with as you get older. Your NSAIDs, your ibuprofen and naproxen, your Aleve, things like that, you have to be careful of how much you take. If you're taking them routinely, like all the time, without advice from your doctor, it could be, there can be hard on the stomach and hard on the kidneys. So if you need those all the time, you need to talk to the doctor about it. Some diabetic medication as you get older can be a challenge because if you go into a low, it takes longer for you to come out of, and you suffer the problems from some of those consequences. So that's why certain, like as you get older, if you're on glyburide, we like to switch you to glipizide. Just it's glyburide you can go into a low and stay there longer. So those are why as you get older, a lot of people are like, but I've been taking it forever. Why would I stop? And it really is just because if you go into low, you can get out of it faster on something like the glipizide. Um, Medications for anxiety or insomnia, um, they can become challenging as you become older. Your body is not processing these medications as quickly. You could suffer from almost like a hangover feeling in the morning. It puts you at higher risk of dizziness and falls, at higher risk for confusion. The same thing with the diphenhydramine. Again, I had a patient who thought he was developing dementia. Um, he was really struggling. He was very confused. Uh, he couldn't do math anymore. And in talking to him, his doctor had been trying to talk to him for a few years about um, the Ambien or Zolpidem that he was taking at night. And um, the patient was just adamant that he was not going to decrease the dose. He finally was willing to try for a week, taking half of a tablet. And he said he was cured. And fortunately, he didn't have dementia, but he was in that foggy brain because his body wasn't processing the medication like normal or like it used to. Um, so those are things to be very careful of. Another thing we want you to know is be careful when you're buying medications like over the counter that have a couple different things in them. Anything that says PM is going to have diphenhydramine in it, which can cause you to be dizzy, have a hangover effect. We really, really want to prevent falls. So be careful. Also, you might get your cough and cold medicine, and then you're dealing with aches or temperature, and you go and buy acetaminophen. But the cough and cold medicine may have acetaminophen in it. So you don't want to be taking two of the same medications. So something else to really be careful of when you're buying some of the medications that have multiple ingredients. And now to get into the topic that I know has been on the news and we've been talking about frequently is, thank God there are now COVID-19 vaccines. Excuse me. So we want to talk about some of that. Um, just for a little bit of information, if you're looking at this chart just by age, the percentages, if you're looking at like 65 to 74, um, as of the week of February 9th, there was about 8% of all COVID cases in the state of Massachusetts. 75 to 84 had about 4%, and 85 and older had 2.5% of all of the active cases of COVID. But when you get into the deaths, the statistics, you get the percentages just jump. So that's why right now, anybody in Massachusetts 75 and older is eligible for the COVID vaccine. And because it has such a high risk of death as you get older, that is why it's so important. Um, a lot of people have questions about the vaccine um, because the vaccine, it seems like it just was rushed to market. But COVID as itself, not COVID-19, but COVID as a virus has been around since 2002. Back with SARS and swine flu and the bird flu, there have been a lot of different versions of a COVID vaccine. So it has been studied for a long time. And as they were putting this vaccine together, they were doing multiple stages of the process at one point. Typically, it's like it goes through phase one, and then phase two, and then phase three, which is what takes a few years. Here, they were doing like phase one and two at the same time, or phase two and three at the same time. And all of the data was being reviewed by scientists who didn't work for Pfizer or Moderna. They worked outside, so they were not biased towards a company, so that they were doing that analyzation of the information coming out to make sure everything was safe. All of the vaccine trials were done on 30 to 40,000 people, including those with chronic disease, which is not something you normally see. And we're still monitoring the safety of these vaccines. As they've been rolling out over the past month, we're not hearing of any serious issues with the vaccine. So those are, things that are still being monitored. And one question is, people feel like they're hearing about mRNA and different things. These vaccines don't change your genetic makeup. They don't change who you are. It's just another way of identifying that virus so that your body has the ability to recognize and start to fight it. So, a couple questions as to why um, you should get the vaccine is if you're exposed to the virus, it's going to help you fight it as soon as you get it. Right now, the Pfizer and Moderna shots are 2-shot series. Johnson and Johnson, when approved, is a 1-shot. Currently, with Pfizer and Moderna, the first shot is a primer to help your body recognize that virus. And the second dose is the booster, which is giving your body memory cells to fight that virus. Um, Once you get both shots, they're about 94% effective. So that even should you catch the COVID virus, you would have little to no symptoms. So the virus, if you were to catch it, it's like when you get the flu shot, maybe you would catch the flu, but it would be a very mild case. So side effects to the vaccine typically happen 1 to 2 days after the injection. They're typically a little bit worse after the second shot because your body really is into that fighting of the virus. Um, Pain at the injection site, really feeling tired, sluggish, headache. You could have fever or chills for a day, and achy. Um, from what I'm hearing from people I know who have been vaccinated, um, most of them are having more of those side effects on the second shot. Um, what I've been hearing is, a lot of tired, sluggish, achy, just, when you're getting your shots, make sure the next day you don't have anything big planned. And managing those side effects are easy with Tylenol or acetaminophen. They're the same thing, or your ibuprofen, Motrin. Um, just taking that for a day or two to fight off those effects. One way to find out more about the medications, let's see if it works, is to going, this is a website, medlineplus.gov. It has information right here about COVID. You can find that. There's information over here about your drugs and supplements. So if you have questions about those. So this is a really good website that if you're looking for information, if you go to your drugs here and you can just type in or scroll down and it gives you a variety of different medications. And let me see if I can find something. Okay, let's try quinapril, which is for blood pressure. It gives you all of these different information categories and information about the medication. So that's a good tool um, to try. Hold on a second. Let me go back. Um, so, so that's pretty much the end. Whoops. Excuse me. All right, so that is the last of what I have on the PowerPoint. There's a lot pharmacy outreach can do, and we like to help in any way that we can. So you can call us with any questions. Again, it's 866-633-8255. 1617. Normally somebody does answer the phone. Because we're all working remotely right now, we don't have that rolling phone line. So whoever's taking their turn answering the phone, you might get a voicemail, but please leave a message. We've gotten very creative with technology, and we've learned a lot over this pandemic period on how to be working together, even if we're not physically in one office. So we would love to answer any questions or help you in any way that we can.
Thank you, Aileen, so much for that presentation. I think you covered a lot of really good information, stuff that I didn't know. And I'm sure that, especially as you mentioned too, even with the pandemic, things have changed. And, there is
Mhm.
a lot of questions. And I think a lot of, you know,
Mhm.
is this fact versus fiction in terms of the vaccine as well. So thank you.
No problem. My
Is there
pleasure.
anything, is there anything else that you think our seniors should know about?
Um, well, there's a lot, and we can provide information. We can also do other webinars. If, say, your seniors have questions about baby blood pressure or diabetic medications, or we have a presentation on asthma and COPD. Anything that your seniors or your older adults are looking for information for, we can totally provide that.
I think
So,
that we can. Yeah, I definitely think that having future presentations about various topics is really going to be helpful.
mhm,
Even for the caregivers of our seniors as well, just information that they can pass on to their loved ones as well. So, but
absolutely.
I truly appreciate your time. Like I said, I learned a lot, and I'm sure that the seniors will as well. So thank you so much.